Hi, I'm Dr. Ron Lemon. I'm a chiropractor in Macon, Georgia. I've been in practice for about 30 years here in Macon. And Dr. Sun has asked me to talk about chiropractic a little bit, what a chiropractor does, what kind of conditions we might treat, insurance questions as well. So I'm going to touch base on a few of those things just to give you a little overview of what goes on in a chiropractic office and what kind of patients we see, so you'll have a better understanding in case you've never been to a chiropractor. So as I said, I've been in practice about 30 years. Our practice sees a wide range of patients, anywhere from infants to senior citizens with severe arthritic changes. Some of the interesting cases we might see with infants would be things such as colic or ear infections. There's a high correlation between upper cervical problems and proper nervous system function, and we do see good results with ear infections and colic type symptoms. All the way through our senior citizens with degenerative conditions and the problems that go along with that. We treat a lot of sciatic type patients, but I think the average person that might come into a chiropractic office would be somebody with neck pain, back pain, headaches. We see a lot of sports injuries, car accident victims with whiplash injuries. So those would be the typical kind of patient that might walk in my door. I'm a single doctor practice, so I practice by myself with the staff. Most chiropractors probably have one or two staff members. Many offices do their own x-rays and examinations and treatment in an office setting. Some use therapy, some don't, to enhance the healing process. But just to give you an idea, when a patient comes into our office, we're going to do a thorough history, take the history from the patient, go over any pre-existing medical conditions, and then evaluate their chief complaint, the complaint that brings them into our office. So we want to do a thorough evaluation of that complaint to get a better understanding of what kind of problems they may have and whether or not it's a chiropractic problem or a problem that we can treat actually. And if not, I need to know, do I need to refer that patient out to another form of healthcare? So chiropractic is the largest drugless healing profession in the United States. So we are a primary care provider, which means we can treat a wide range of symptoms and illnesses and disease processes. But as far as that goes, I think the importance of chiropractic is that we have our scope and our limit of what we can do, and I think chiropractors are pretty good about knowing what they treat and what they can treat. But it's important to know when you need to refer out to another provider. That's in the patient's best interest, and I think chiropractors are very aware of that. And I think that you'll find the cooperation between medical doctors and chiropractors today to be very good. So we see a lot of patients referred to us from the emergency room or from other orthopedic practices. When it's not a surgical condition, they will recommend some kind of conservative care, and chiropractic fits that bill. So chiropractic is the form of health care that addresses the correlation between the nervous system and the spinal column, and that delicate balance that the nervous system is protected by that spinal column. But any dysfunction in that spinal column, sprains, strains, posture stresses, any injury to that column can affect the nervous system and those spinal nerve roots that come out of those segments, and they go to other organ systems and can have an effect that way. So our focus is really on targeting that spinal structure and improving that function and trying to bring that nervous system and that spine back into the best shape possible so that the body can heal. I'm going to go over a couple. I've got some cheat sheets here. Dr. Sun asked me to cover a few things. Like we said, we cover a wide range of conditions, anything from, as I said, treating infants, maybe with colic or ear infections, sports accidents. We see a lot of sports injuries, a lot of softball players, baseball players, young people, playing sports, and we see the strain sprains that affect the spinal column, the pelvis, and those joints are treated very effectively in a chiropractic office. Even pregnant women, we see a lot of pregnant women with back pain, and that surprises a lot of people, but it's just a testament to how gentle and delicate chiropractic is, that we can work with a pregnant patient safely when many other providers can't do anything for them for their sciatica or back pain. They just would be told to sit at home or lay at home and just wait till the baby's born, and then they'll deal with it then. But we see a lot of pregnant women, which is nice. A common issue we see right now, probably the most common thing we're seeing now, is what's called text neck. And as a student, you're probably aware of too much phone time, too much laptop with the head down posture. We see a lot of strain in the cervical muscles with that, and that's a very common issue now with people who work at, say, insurance companies like Geico. The body was not made to sit at a computer for 8 hours a day, so we see a lot of those kind of cases now. That's probably the most common patient we see walking our door, is somebody with a neck and shoulder complaint. And again, managed very effectively with chiropractic, and the treatment that we do, it's very safe, it's very effective. Back pain is a very common one as well, low back injuries, work-related injuries. The federal government has actually come out and said that chiropractic should be the first choice for acute back pain. And the reason they did that was it's safe for the patient, it's cost effective, and we get patients back to work faster than any other healthcare system. So for acute back pain, a chiropractor is the appropriate pathway for treatment. And again, if it turns out to be something that's outside that scope, if we have a ruptured disc that looks like it might need surgical intervention, then our job is to pass that patient on to that orthopedic surgeon or appropriate care. But chiropractic is a good starting point and a good point for back pain treatment. So we see a lot of those as well. We talked about us being a primary care provider. One of the things that chiropractors can do, we can sign health certificates, patients being out of work, kids being out of school, we can sign those certificates under our license. We can take people out of work, allow them back in with work restrictions. That falls under a chiropractor's care. One thing that we also look at is we see a lot of senior patients that have deconditioned, and one thing with Medicare wants to see improvement in a condition. They don't want to pay for care that isn't effective. So in our senior patients, one of our biggest goals is to get them moving and get them active faster, and chiropractic is perfect. Drug therapy for back pain is a bad way to go. It sedates people, it makes them less active, they lay in bed longer, and usually those conditions worsen. Chiropractic is designed to mobilize joints, reduce that irritation as fast as possible, and then educate the patient on proper techniques that can help them get stronger faster. So we kind of combine some orthopedic and some PT together, and that's sort of what chiropractors do. So that's an appropriate thing that we see a lot of older people that we try and get functional again. Chiropractic is covered by Medicare, by the VA, by most insurance plans cover chiropractic with some exceptions. But just like any other healthcare, PT or anything else you might go to for treatment. So when you come in, a chiropractor, as I said, will do a history and then a thorough examination of the primary complaint. So if it's a neck condition, we may look at those neck joints and make sure that we have stability, that we don't have any red flags that might indicate a herniated disc and might warrant some other kind of care. So we'll check reflexes, muscle strength, and range of motion, and make sure that it's an appropriate injury that we can treat. After a thorough examination, we may or may not require x-rays. We may or may not need an MRI exam. And that depends on the findings that we see in the exam. But many times we can safely treat a patient because our care is so gentle and so delicate and well within what the body will tolerate that we don't always have to have an x-ray or an MRI. However, if we see a red flag that makes us worry about a disc herniation, we may want to get that MRI or that x-ray right up front. And we can either refer for that, or some chiropractors will take their films in their own office. So treatment consists of spinal manipulation, and you've probably heard how chiropractors adjust the spine. We have some of the older techniques that were more of a hands-on type of technique where we may put a lot of force into a spinal segment to try and get movement again. And because we're so slow in the old days, we would have to use a little bit more force to overcome that resistance of the muscles. But nowadays we use, many chiropractors using instruments to adjust with. And the beautiful thing about the instruments, which came around in the 60s, is that they're so much faster to adjust that spine that we can use less force. So I've got a couple instruments here. This is one of the instruments, the activator instrument, that was around in the late 60s to early 70s, and it's been modified a number of times, and this is the latest version of this one. But it's got a very soft tip on it, but again, it will let us get into that joint space and deliver a very light, quick thrust and mobilize that joint. It's very comfortable for the patient. But we would do a series of tests to try and determine, did we move that joint? We might have to go back and adjust again, and it was a little bit slow. We've got a newer instrument now called the Impulse, and this instrument actually Still has a little stylus type tip, soft tip here, but it's got a computer inside. And when we get the appropriate force here, you see this little green light come on, it's going to give me multiple thrusts. And you can see it thrusting there into that. Okay, and you hear that tone. It's going to give me multiple thrusts until it picks up a significant amount of movement in that joint tissue. And once that joint is moving and articulating like it's supposed to, the machine shuts itself off and gives me a single tone. So I know that I've mobilized that joint and done my job with that segment. So it's very comfortable to the patient, it's very safe. We never have to worry about too much force into the spine. So again, this is what lets us treat a wide variety of patients, a wide range of patients, anywhere from that pregnant woman to that senior citizen or that infant, and not have to worry about too much force. So it does allow a lot of treatment to cases that we, in past years, wouldn't have been able to treat. So in a minute, I'm going to show you a patient on the table and show you how we actually use that instrument, and show you that it's a very easy, comfortable technique. So if you haven't been to a chiropractor and you have any of those kind of neuromusculoskeletal health problems, neck pain, back pain, sports injuries, or even just postural stresses, a chiropractic exam is a good way to start, and a chiropractor could probably get you on the way to good health again. So we'd always be happy to see any patients here at this office. It's Middle Georgia Chiropractic, Dr. Ron Lemon, and I will show you in just a second some adjusting technique on a patient. Thank you.